In this video, I'm going to talk about the benefits and risks of getting an epidural. Sometimes in labor, you may decide to get an epidural for pain relief. Maybe you knew you wanted one as soon as you were pregnant. Maybe you have health concerns that an epidural would be more beneficial for, or labor just turned out to be more difficult than you imagined. No matter how you came to this decision, you will need to know the benefits and risks. The one major obvious benefit is practically complete pain relief. While you may continue to feel the tightenings of contractions in your uterus, there will be little to no pain associated with them. Some other benefits are that it allows for sleep and rest if you're exhausted. It has less side effects for the baby than systemic drugs like morphine or fentanyl, or it may help if you have a hard time relaxing and labor progress has been slow. In this case, often the epidural allows for complete relaxation and much faster dilation. The risks or special considerations are a bit of a long list. First of all, you do need an IV, and you'll probably be restricted from eating or drinking any longer. You'll likely be unable to move and therefore be restricted in the bed. You'll probably receive the continuous fetal monitoring. You'll have a blood pressure cuff here that is usually left on your arm and just goes off every 10 minutes or so. Some of the risks are that you may develop a fever. You could experience a blood pressure drop, which is actually why they always give you an IV to help stabilize that. It can cause itchiness all over. You may need a catheter, as women are usually no longer able to urinate on their own. It may slow down labor, which could lead to synthetic oxytocin use. It may only work on one side, or it might not work at all, unfortunately. It can impede the fetal rotation and descent. It can mask the feeling of needing to push and make pushing less effective, thereby taking longer, or that you might need the help of a vacuum or forceps. You may get a headache if the needle is placed in too far. That happens about like 1 in 100 times. You may experience some bruising-like pain at the catheter site, but I'd say that's to be expected. There's some very rare complications, which include dizziness, a rapid heart rate, a funny taste in your mouth, or difficulty in breathing. And they can actually cause nerve injury or paralysis, although this is very, very rare. Effects on baby are commonly argued about, as it's not known whether those were a result of other things that happened in labor or as a result of the epidural. Some say that some of the narcotic reaches baby, causing them to be a bit drowsier or not as interested in breastfeeding. However, the amount that the baby may get is much lower than if the mother takes the narcotic through an IV. While this list can seem really daunting, complete pain relief is pretty lucrative. It's up to you to weigh these benefits and risks and decide what is right for you. Only you know what is best for you and your family.